Welcome, everybody. Look, the world and America and Colorado have come a long way since March of 2020, when our world was turned upside down, when we had the first case of COVID-19 here in Colorado. It honestly feels like another lifetime. Fast forward to where we are today, 82% of Coloradans have gotten at least one dose. Well over 90% have either had immunity through infection or the vaccine. 73% of eligible Coloradans age 5 and up are fully vaccinated. We have one of the lowest death rates in the country. Our economy has recovered more than all the jobs that were lost during the pandemic. We have more employment now than Colorado's ever had. But just because we're in a good place now doesn't mean we should let our guard down. In fact, we really owe it to the people of Colorado to learn from the experiences of the last 2 years to prepare for whatever lies ahead, whether it is COVID-19 variant, whether it is a terrible flu season, whether it is a different pathogen. No matter what happens, we need to learn from the real stressors of our healthcare system these last 2 years so that we can do better. I'm proud to be joined by our Lieutenant Governor and many others in our COVID response team. Later this week, Dr. Hurley will be providing an update on COVID-19 in Colorado, including modeling. It is, like in many areas, other areas of the country, showing modest increases. Once again, it's on the march. We had our first increase in hospitalizations yesterday in 2 weeks. The throes of managing our hospital capacity day to day, but everything that adds to it is additive, right? So if you have COVID and you have the flu, you have a multi-car accident, you have other situations, we always, our North Star from the very start was we want to make sure we are not exceeding our hospital capacity in Colorado, which means if you have a heart attack, a stroke, cancer, COVID, the flu, you need hospitalization, you get it. We succeeded in doing that. That's one of the reasons we have a lower death rate. Areas that experienced overwhelming of their hospital capacity tragically had unnecessary deaths. Earlier this year, we announced our roadmap to moving Colorado forward, our detailed plan for the path to preparing and learning from the last 2 years so that we never face those kinds of awful choices that we faced in the past again. And some of those recommendations are directed to the federal government. We have shared those with the National COVID Response Team. Others are really recommendations for the state. And today, we're very proud to announce with thoughtful members of our legislative leadership a very strong package of COVID readiness legislation. More than just COVID, it's really about healthcare readiness legislation, because I mentioned COVID is additive to whatever else is going on. It may very well be COVID that increases again. We hope not to the levels it was, but there are many other potential threats out there. And we want to take these recommendations into action. 3 critical areas that we outlined that we won't need to take action on are ensuring that healthcare systems have an adequate supply of the critical supplies like PPE. We all remember those early days. One of the reasons that the country had to take the extreme steps it did is literally there were no masks and gowns at hospitals. There were no supplies to be able to treat patients safely. We cannot let that hold us back again. We need to make sure we are ready for whatever lies ahead. The state and the country burned through the PPE stockpile in a matter of days after that first diagnosis. And so we need to make sure that going forward we have supplies. 2, hospital readiness. We need to make sure our hospitals have surge plans. They don't, not on the fly, not once there's a pandemic, oh my gosh, how are we going to expand beds, but have it ready, in a binder, ready to go. Where is it going to be? Who's going to staff it? Let's have that plan to do surge readiness, preparedness metrics, staffing for any future surges that might occur, so we're not placed into an emergency situation, whether again it's COVID, a bad flu season, or whatever else comes our way. And finally, a major investment in healthcare workforce to improve recruitment, retention, and training opportunities. Look, there's been a lot of burnout across our economy and people changing jobs, but one of the most challenging jobs that have been in the last 2 years has been in healthcare. And so we need to make sure we can retain people across the board, from nurses to doctors to other hospital workers, and encourage them to continue to thrive in their profession, but also look at the pipeline for the future to make sure we have the people that we need to take care of an aging population and, of course, a population no matter what pathogen comes our way. This legislation builds on existing efforts. I'm so proud of our AmeriCorps Colorado Healthcare Workforce, Colorado Healthcare Corps, which we launched out of AmeriCorps under the Lieutenant Governor's office. Great additional possibilities for them to continue to do that as well. We're currently recruiting 150 members to serve, all of whom will get training, career coaching, and support. This work is even more critical as even now parents are still waiting for approval of a life-saving vaccine for children under 5. I sent a strongly worded letter to the White House just this week encouraging them to move quickly based on the data for approval of the vaccine for children under 5. And I hope that we get that approval soon. I read it might be as late as June, but the sooner the better. We have that available today if they simply move forward with the approval. I want to first thank all of Colorado's healthcare workers, our COVID response team, many of them are here. And of course, I want to express my condolences to every Coloradan that lost a family member to COVID in the last 2 years. This has been a difficult time. I lost 2 friends to COVID. I think that it's touched almost all of us with either people who have experienced severe illness or in the worst cases haven't made it. I also want to thank our legislative champions who have championed the efforts both during the crisis and now to prevent future crises, including Representative Mullica, Representative McCluskey, Senator Jaquez Lewis. I also want to thank our speakers, an ICU nurse, Hannah Warnicki from the Colorado Nurses, Allison Trope, an emergency department doctor. You know, turning these bills into law means Colorado will not be starting at square one if or when another surge of COVID or another pandemic comes to our state. We want to have the foresight not to be caught flat-footed again, as our nation and the world were in the early days of COVID-19. We will be ready to respond, to manage the situation, to avoid overcrowding our hospitals, and these efforts will once again show that Colorado is leading the way in thoughtfully incorporating the lessons of the last 2 years into policies that will prevent future emergencies, hopefully making Colorado a model for the country in COVID and pandemic preparedness. And now I'm honored to introduce one of our leaders in the state legislature on this topic, and a nurse himself, Representative Kyle Mullica.
First off, thank you all for being here. I also want to take this opportunity to thank the governor for the leadership that him and his staff have shown on this issue, truly making sure that Colorado is going to be a leader in this area and that, like he said, we'll never be caught flat-footed again. I wanted to start off here with you before I get into the bills of sharing my story, of working on the front lines the last 2 years, of being there the day after that we went into adjournment here, going back into the ER and seeing that fear in my colleagues' eyes in the ER, not knowing what we were having to deal with. But in addition to that fear, not having the supplies to potentially protect ourselves, having to reuse N95 masks, seeing some nurses and respiratory therapists having to utilize trash bags to protect themselves. And that's not all right. That's unacceptable, and that's what we're trying to do here is we're going to make sure that that never happens again and that Colorado's prepared. We had instances when I went into the ER, I'll never forget, I was working a day shift and I was going in to take report from the night shift. And I went over to the desk to get report on the patients that I was going to take over, and she put her head in her hands and just started crying. Just started crying because of the night she had, because of the lack of support that she had. That's unacceptable. These are the people that take care of us. And these are and with these bills, we're going to make sure that we're taking care of them in return. The bills that we're looking at doing, the bills that you're going to see introduced, are not only around PPE. The PPE bill is already in the system, where we're going to make sure that Colorado's prepared, that we have a stockpile so that we don't have to rely on somewhere else or someone else to provide that we can wait for that stockpile to build up and for that pipeline to build up so that we can make sure that not only our healthcare workers are protected, but the public's protected. In that bill, you'll see that the Department of Safety can send those materials and that PPE out to our teachers, out to our community, make sure that they're protected as well. But more importantly, what we're doing is we're making a historical investment in our workforce. We know that in Colorado over the next 5 years that we're going to be short 10,000 nurses and 54,000 auxiliary staff, so our CNAs and our EMTs. And we're investing in that. We're going to make sure that we're putting money to get people into that pipeline, that we're putting money to build preceptorships, that we're building money to add capacity so that we can bring nurses into the system and healthcare workers into the system. But that's not good enough just to focus on workforce. We need to make sure that we're protecting those workers as well, that we're investing in those workers, and that we're making sure that we're not in this situation 10 years from now, that we're making sure that we're stopping some of the burnout that we've already seen with the mass resignation of our healthcare workers, and that we are putting protections in place and holding our hospitals and employers accountable, and making sure that those hospitals and those employers are ready for if we see another emergency or if we see another surge. And that's what we're trying to do here today, and that's what we're doing with this legislation, is that today we make those historic investments in the people who take care of us every single day. These bills will ensure that Colorado is taking care of the people who take care of us, and that we are prepared for what's to come. And so I'm excited for the historical investments. I'm excited that Colorado is taking a leadership role in this. I think other states are going to be looking to us for the work that we're doing, and look forward to speaking with you more about the bills that are going to be coming and introduced in the coming days. And with that, I would like to introduce Dr. Troll.
Good afternoon. Thank you, Governor Polis, for the opportunity to speak today. My name is Allison Trope. I'm a board-certified emergency physician, and I'm speaking today on behalf of myself and the Colorado chapter of the American College of Emergency Physicians. The past 2 years have been a whirlwind of experiences for healthcare providers across our state. No one in practice today has experienced an event like this, not since the 1919 influenza pandemic. The beginning months of this pandemic were quite frankly scary. We didn't know much about this virus. We didn't know how easily it was spread, what the long-term effects could be, or how those would affect people. I remember my first critically ill COVID patient in March of 2020. It was like nothing I had managed before. It was the first time I can remember thinking that this unknown disease could be putting my life at risk the moment I walked through that door. Thankfully, we now have safe, effective, and widely available vaccines provided for free by the government. This has served to help bolster our defenses while fighting this novel disease and mitigating community spread. The experiences of emergency physicians across our state during the surges of the COVID-19 pandemic have been varied. Many healthcare communities across the state suffered PPE shortages. At times, they were manufacturing their own hospital gowns and face masks. Students from the Colorado School of Mines used the resources and technology available to them to 3D print face masks and hand-delivered these to many facilities across our state. I remember several shifts where construction crews from the community came to our hospital to give us their N95 masks. Normally they'd be using these to protect themselves on the job site from particle inhalation, but instead they were giving them to us to protect us in this trying time. This kindness was greatly appreciated. It helped bolster morale just knowing that the community was behind us. This forward-thinking legislation serves to create stockpiles of PPE that would help healthcare teams to avoid these situations in the future. As an emergency physician, we pride ourselves on being available 24/7, 365 for any emergency or disaster that comes through our doors. Knowing we have a supply of PPE available to help us better perform our jobs and keep us safe will help us to continue to care for the people of Colorado. Over the course of the pandemic, I think all healthcare facilities have suffered with managing decreased staffing availability. This was for various reasons, but included healthcare workers out sick with the very virus we were attempting to treat, and at home caring for family members and children who were infected and unable to attend work or school. We also saw significant healthcare provider burnout, which led to people leaving the healthcare field permanently, further impacting our ability to staff facilities and care for patients. On the positive side, the healthcare community has rallied behind each other, and I know of several facilities who have created peer support programs so healthcare workers can discuss the impact of difficult cases and how it has affected them personally. Especially during the pandemic, we were seeing extremely sick patients struggling with our own fears of being infected and unintentionally taking that virus back home to our loved ones. This pandemic helped us to see how fragile our healthcare system can be, and that we need the safeguards provided by this legislation to improve healthcare provider wellness programs and clear the path for those called to work in the healthcare field to enter the field and begin to practice. We support the idea of training our next generation of healthcare providers in Colorado and providing incentives for them to stay in our beautiful state. The Colorado chapter of the American College of Emergency Physicians are excited to continue to collaborate with the governor's office in preparing the state of Colorado for whatever difficulties may arise in the future. Thank you for the opportunity to speak with you today.
Hi everyone, good afternoon. My name is Senator Hawkins Lewis, Sonia. I represent Senate District 17, that's Eastern Boulder County. And it's really a pleasure to be with you all today. It's no secret, the last 2 years plus have been very tough. We've gone through some incredibly challenging times. We've weathered difficult storms, and we've held strong in the face of this adversity. I would like to share with you a really quick personal story too. I'm a pharmacist, and my spouse Allison is a hospice nurse, but she was working in the hospitals when COVID hit because we had a shortage of nurses who could go into the hospital. So we would have a plan, but 10 minutes before she would come home, because we had a shortage of PPE, she would call me or text me and she'd say, okay, I'm on the way home. And so I would get bags ready, and we would have a bag where we could recycle the PPE and try to save it. And then we'd have a bag where she would throw her clothes off, right? We'd have to wash the clothes, and then she'd have to run up, take a shower, and then we could finally start our day and talk about what she had just been through, and talk about the family and friends and people that we were hearing that we were losing to the pandemic. I lost one of my cousins, Don Vahil, in Lafayette, who was one of the first people to die in Boulder County from COVID. But fortunately, we find ourselves in a much better position today. Thanks to science, thanks to the effective and safe vaccines that we have, we've saved countless lives. And we can gather today, as we are now, we can gather safely indoors and outside. And I'm really grateful for that. And so we're moving into a new phase of the pandemic. We're learning to live alongside this disease. And we're taking steps to mitigate and to continue to balance our return to our regular daily activities, keeping ourselves, at the same time, keeping ourselves and our families and our communities safe. And a part of this process means taking lessons from that experience. And today, we are getting ready to unveil our roadmap to moving Colorado's COVID response forward. I am so proud to be sponsoring 2 bills to invest in Colorado's provider workforce and to better prepare and equip our healthcare heroes. A bill I'm working on with Rep. Mullica will expand and invest in the number of healthcare workers and especially nurses in Colorado. I'd like to tell you just a little bit about that bill. The first part will address the shortage of our healthcare workers by assisting with tuition and fees and to help get more people into these high-demand healthcare fields. The second part of the bill will encourage healthcare facilities to provide more training slots, and that will include simulation labs, advanced robotics to help train our healthcare workers. That's the bottleneck that we're facing with our workforce. And this will create additional slots to give us that capacity and better training. And finally, many of us were really affected emotionally and physically during the pandemic. I know Kyle as an ER nurse. I know my spouse, Allison, as a nurse. Many folks need some additional help to recover how they were impacted in a pandemic. And we're losing healthcare workers because they have no one to talk with about what they just went through. So the other part of this bill that I'm really proud of is addressing those needs in expanding and investing in employee wellness programs to help our frontline heroes and help with our retention efforts. This legislation will result not only in better quality of care for Coloradans, but will give our workers more advanced skill set training. The second bill that Rep. Mullica and I are working on will do more to ensure that healthcare workers are protected should we face another health emergency. As you've just heard, the early days were chaotic, and we were in short supply of PPE, our personal protective equipment. The next time an emergency arises, we'll be better prepared with House Bill 1352 to direct the Department of Public Safety to maintain a stockpile of PPE that will keep our workers healthy and safe in a declared health emergency. We will have the masks, we will have the gowns, we will have the gloves to keep our workers safe, and we will have emergency supplies that we need. Thank you, and I'd like to bring up Hannah Mordecai.
Thank you. My name is Hannah Warnicki. I am an ICU nurse in the Denver area. Over the past 2 years, we have seen tremendous challenges as healthcare workers and as a community. I had the privilege of learning in pre-pandemic healthcare, but then faced the difficulty of being a new ICU nurse in the height of the pandemic. What we first approached as a sprint has, in many respects, as we now see, become a marathon. As we continue to navigate the realities we are facing, it gives me great hope to see the emergence of this roadmap to moving forward that our state legislature is working toward. Our greatest ongoing challenge truly is figuring out what it means to create sustainability in the healthcare setting. How do we transition from the sprint mentality to the marathon mentality? For nursing, this means many things, from supporting the pipeline of new healthcare workers to evaluating what best supports nurses in their practice. During any given shift, what matters most to me is my patient's safety and their humanity. The days where my colleagues and I are each doing 130 to 150% workload, it is all we can muster to maintain safety. And even that becomes difficult on the most challenging days. Something has to give, and it's that human element. That's not the care I want to give, and that is absolutely not the care I want my loved ones and community members to receive. What wears me down and fuels the fire of burnout and moral distress are the days when I don't have the chance to acknowledge my patient's humanity. Contrast this to the days where I have time to learn about who they are as a person, to dive deeper into their plan of care, and to work with our providers to form creative solutions to complex problems, to update their family, to do those extra safety checks, to help them find a sense of comfort in a place that is so uncomfortable. This is when I feel I could acknowledge their humanity and give them the best nursing care I know how to give. Consistent staffing is the single greatest variable in my day-to-day lived experience that distinguishes the former from the latter. Creating structures to support this not only builds the sustainability of nurses' day-to-day work, but is also so desirable in the healthcare community that the implementation of similar laws in other states has in many respects made them destination states for healthcare workers. This is a crucial step presented here alongside other promising initiatives to support emergency preparedness, enhance stability amid adversity, and develop a robust and versatile workforce. As a healthcare hero over the last 2 years, I am asking our legislators and our community to not let our collective struggle be in vain, to take these important steps forward to bolster our front line and our foundation as we move on with this moving forward roadmap. And finally, I would like to sincerely thank Governor Polis, Representative Mullica, Representative Hawkes Lewis, and Representative McCluskey for their leadership and support of these critical initiatives. Thank you.
That was powerful. First, my thanks to Governor Polis, Lieutenant Governor Primavera, Senator Hawkes Lewis, Representative Mullica. It is an honor to serve with you and to be working on such an important moment in Colorado's history. I also want to give my thanks to the local public health leaders and staff, the healthcare workers along the Western Slope and in rural Colorado, and particularly our rural hospitals. You know, Colorado's rural hospitals endured tremendous pressure, particularly at the start of the pandemic. We know that rural providers in general face very unique challenges and workforce shortages that are extraordinary. They're exacerbated by the high cost of living in our regions and higher costs for care and housing and everything else. COVID hit in my hometown very first in Colorado in March of 2020, and I remember the fear that was literally palpable at that time, not knowing what was next for any of us. We continue to be at higher risk up in the high country because of our economic drivers around tourism and outdoor recreation. We need to be prepared for whatever challenges come next. I am so proud to be carrying Senate Bill 200 along with my colleague, Matt Soper from Delta County. We will be providing $10 million in federal economic relief funds to bolster our rural healthcare infrastructure and technologies. We're going to be saving people money and improving the sustainability of rural hospitals and clinics. This bill increases access to critical care for Coloradans in our part of the state, including behavioral health care and substance use treatment. The bill funds extended primary care hours, dual-track emergency department management, expanded telemedicine, and in-demand patient services, such as mental health and substance use treatment. Rural hospitals and clinics are critical to making sure we meet the demand for healthcare in Colorado. And just as we have repeatedly met that moment when COVID surged in the high country and the Western Slope, we are there now for these rural providers to make sure that we're making an investment for our future. This funding will go a long way. It will go a long way to protect those services. Again, I want to shout out my thanks to all of the rural healthcare providers, particularly our hospitals, who rose to the occasion, provided exceptional healthcare services to the people in their communities, providing that security and safety and knowing that we were going to be okay. Thank you.
We'd be happy to take some questions.
Governor, I know at least one of these initiatives is funded by ARPA dollars. Are you guys concerned at all that having the one-time investments won't mean there's the state's prepared in the next decade or 2 decades? How will you sustain those investments beyond just the one?
I'll go to the chair of the JBC for that one.
Thank you for the question. The one advantage of having this infusion of ARPA dollars at this stage of the game is it allows for us to make infrastructure, technology investments that aren't necessarily ongoing costs. For our rural hospitals in particular, where we're putting some of these federal funds, these are investments that are long overdue. By taking the time now to put that money there, we can address the ongoing costs, I hope, by seeing some efficiencies, some streamlined and improved services, and certainly save in deficiencies that we've been facing over the past months and years.
Could you talk a little bit more, Representative Senator, about the workforce bill? I mean, where's the money coming from? How much is it? And exactly how much are you helping to pay tuition that it will get people into the system?
Sure. Thanks for the question. For more information about the workforce expansion, come up here. We're doing it together. It's approximately 61 million, and to the heart of your question, some of it is one-time funding. We need equipment to help train our healthcare workers. Some of this equipment is expensive. The simulation labs and the robotic equipment, that's quite the investment, and that kind of technology training will last for years and years and years, and that will help us, as I was speaking about earlier, really resolve some of this bottleneck of how do we get folks in, trained, and off. And then if I can give you one example, there are patients that are in hospitals or in larger facilities. We can't send them back home to the rural areas where they want to be with their family because maybe the skill set of the nurses and the other medical workers in the rural area, maybe they haven't been able to train on a particular procedure so that they can have the patient going back home. We can fix that now with some of this equipment. So I've never been more encouraged about an effort to expand healthcare workers as I have been working on this legislation with Rep. Mullica. It really, I know you hear this word a lot, it really, really is transformative.
And I'll just add to that real quick, Ed, is that it is a historic investment in the tuition side. We're trying to really create that pipeline with CNA, EMT tuition to really get workers in that pipeline. We believe it's a win-win. Not only are we filling some of those auxiliary positions that we're so short on, but we're also getting people in that pipeline where they can transition into higher level careers. But we also, we can't just do that without building out the capacity as well. And so we're working on making sure that there's funding to build out the capacity so that that there's room for these individuals to go through the system. And then I think in addition to that, the hope is that the hospitals have been at the table during this process. They've bought in, they've been extremely helpful, that they also put that skin in the game and come in and make sure that we're doing something to really fill that gap of, that we're going to be 10,000 nurses short and 54,000 auxiliary staff short over the next 5 years.
Representative Mullica, you mentioned hospital accountability in your opening remarks. Could you elaborate on that, please?
Yeah, I think, we're making a historic investment. Senator Hawkes Lewis said $61 million. Our state's never seen that type of investment in the healthcare workforce and to protect the people who have been taking care of us. And so that's where that accountability is going to come in, is we're going to put this investment in, and Colorado's going to take a leadership role in that. We're going to also make sure that we're not going to be in this position 10 years from now, and we're going to do everything we can to stop the burnout and the resignations and the individuals leaving these professions. And so we don't think that it's just a one-sided coin. We think workforce is one part of the solution, but also those protections are going to be the other side.
How is the state going to prevent the burnout?
Yeah, I think that we're going to be working with the hospitals. We're going to have policies in place to make sure those protections are in place. We've built upon that already with Chapter 4 rulemaking. We have staffing committees in place, but I think that there's going to be some steps that we can take, and you'll see that in the upcoming bill to make sure that there's accountability and there's protections in place to make sure that those workers can do the job that they signed up to do, which is to take care of people.
Sí.
So my question is, ¿cómo crees que estar preparados para cualquier circunstancia ayuda a una mejor economía o al crecimiento de la economía?
Aprendemos mucho entre la pandemia y necesitamos usar esta información para preparar mejor antes del próximo crisis. Tal vez pandemia de COVID-19, tal vez otras infecciones. No podemos saber qué la futura va a tener, pero necesitamos preparar mejor. Necesitamos tener, por ejemplo, ropa protectiva para nuestros médicos. Necesitamos tener suficiente tapabocas para los hospitales. Y necesitamos aprender. Los 2 últimos años eran muy difíciles por toda nuestra población del mundo y necesita usar nuestros planes para mejorar la situación en la futura. Thank you everybody for joining us.